Hello, everyone. I'm very happy to have Dr. Naresh Bhatt with me today. And today's topic is a kind of touchy one because many times the families may not have a choice of taking care of a loved one who has got chronic illnesses and they're working. Many situations can be there where the loved ones cannot be taken care of at home, and having 24-hour care is very expensive. So they decide to put people, their friends, their father or mother or parents or somebody in a nursing home. And so today's topic, Dr. Butt is going to talk about overseeing a care of a loved one when they're admitted in a nursing home. And what are the things that you see? So welcome, Naresh Bhai. Welcome.
Thank you very much. Hello, everybody. Uh, it's a big topic. Nobody would like to put their loved ones in a nursing home as far as they can help it. They would like to do it themselves, but there are times when they have reached the end of the rope and they cannot afford it and they cannot physically or financially be able to continue caring for their loved ones at home, and it's very taxing because they have to take care of the families, their children or grandchildren, their pets, and the parents or grandparents, and they are forced to make this decision against their choice, against their wish, but it has to be done because they are simply not able to meet the necessary requirements of their loved ones who are needing a lot of care, and then that's the reason why they put in. And in order to be sure, of course it's a worry, we have to be sure that our loved ones are getting reasonably good care. Part of the problem is the homework that goes in before the facility is selected. So it's a lot of homework on the part of the significant others, either husband, wives, children, or grandchildren, or friends, or whoever is deciding, brother, sister, whoever is deciding to put their loved ones in a nursing home or a intermediate care facility or a long-term hospital, wherever. And there are always pros and cons, but they should do the homework. For example, one of the first things, obviously, that they would find out is preferably that the place where their loved ones are placed is not too far from the person who's the significant other, that they can reasonably visit them maybe once a month or every other week or something like that. That it's not physically too far, and they would look up the ratings of the place as to how it is rated. Is it good? How many stars they have? And then they can look up their reviews online and find out if they can find out from the other people who may have experience or neighbors or uh, they can visit the facility obviously before they are placing their loved ones, and go over a few aspects. Number one aspect is the cost. Are they able to afford it? Are they going to be stuck with big bills? What kind of insurance is going to cover, how much the insurance is covering the care, how long are they going to cover the care, is there any long-term insurance, is there any secondary insurance, or how are they going to pay for the care? Are they going to be liquidating some assets of the individual, the loved one, or how they're going to pay? Because it's frequently a much longer term, the placement, depending upon, of course, the longevity of the person and all the other issues, and what all other medical issues they have are also important. The next thing is the uh, facility itself. Obviously, they would be interested in visiting the facility and checking out and asking questions as to what is the success rate of how many people, and they would go over the ratings, they would go over the nursing home care regulations and criterion, and find out what kind of track record this particular facility has and what kind of staffing they have. When they visit the nursing home, they would see how the other residents are being treated, or are they screaming with pain? Are they over sedated? What kind of conditions the other residents are. The other thing you want to check is the rate of the infections, the rate of complaints against the facility. So there are a lot of different criterion that they can look at. The other few items, I have these things documented, and they are available online, and I don't have all the information at this time, but I can make more information available to the interested people. For example, I have a printout of the what are the Florida's nursing home standards, for example, from a company, Goldman and Associates. And there are a few bullet points that I can go over, which are very important. This is just an example, but whether it's Florida or anywhere else, I think the criterion should stay the same. Uh, Balanced and nutritious meals. Are their loved ones going to be getting balanced and nutritious meals? Yes or no? Preferably, the loved ones should be present and look at some of the residents eating before they put the loved ones in there. And on several different spot checks, they can see if the uh, people, especially if they're demented, are they being served cold food, or are they being treated nicely and given warm foods? Are they being given late food, or are they being given on time? Are they being treated properly or mistreated? Are they having some group activities? Do they have some medications? How they are given? Are they given on time? And are the nursing home personnel treating people with compassion and respect and tenderness or not? And are they answering the call bells reasonably soon enough or not? What is the night nurse staff look like? Are they answering call bells reasonably soon or not? Do they have any activities? Do they have any schedules? Are they have any entertainment sessions? Do they have any external people come and visit? They keep the people entertained, and do they have any people giving some talks? Are they having group activities? Are they having some physical therapy, occupational therapy? Are they having social workers? Are they having some guests? For example, around Thanksgiving or Christmas, do they have any visiting agencies, and give some extra attention to the loved ones? Do they have any outings for the activities of the residents? And also, you want to look at the residents, if they have any decubitus ulcers, how many people are stuck in jerry chairs, how many people are ignored, how many residents are screaming for help, and are the staff being reasonably compassionate? Are they being abusive, or are there any signs of verbal or physical abuse? Are there any patients complaining, or other families complaining about the care of their loved ones? So when you visit, you have to notice all these things before and after you place your loved one in there. And not only just put them and forget about them, keep on visiting and ask the loved ones, are they having a good experience? Are they satisfied? Are they having any complaints? Is there somebody rude to them? Is somebody pressuring them, forcing them? Is somebody using any pressure techniques? Are they treating them with respect? Are they answering the call bells, especially at night? And one of the very important things is bedpans. When the patients are not able to urinate or go to the bathroom by themselves, are they putting the railings up and leaving them in pain or screaming all the time to get help? Or are the employees answering reasonably soon? Are they being turned? Are they being looked at? Are they being given attention? Are the staff being responsible and responsive? So there are a whole lot of factors that I cannot possibly enlist every single possible thing, but these are just some things that we can look at. And I have suggestion that if I get a number, or maybe you can get a number of people who might be interested in more details and having all this spelled out and listed from A to Z, I can make a formal list of all the different things that can be looked at. And these things have to be assessed on a longitudinal basis by a significantly interested caregiver, or by the family or significant other, or a contact person, or a legal guardian, or any kind of person who has put their loved ones in this predicament, especially if the patients are demented or deaf, they cannot hear or they don't understand, then there is extra reason for extra visitation on the part of the loved ones to be involved actively and keep on following up longitudinally, like every 3 weeks or every 4 weeks or something like that, and check them themselves to make sure that the people are, the loved ones are dry, they are not incontinent, they are not laying in their feces for several hours, they don't have any new ulcers on the heels or greater trochanteric areas, pressure points on the back, sacrum, because rarely people, even including the nurses, they may not even turn the patients regularly. And the patients, if they're unable to verbalize their complaints, there's all the more reason why they should be checked frequently by the caregivers or the loved ones who put them there in the first place. So I'm sorry to be so long winded. I'd like to take a break and get your response at this point and uh, get me where you want me to be if I'm too long.
Thank, thank you very much, Dr. Bhatt. It was a wonderful, wonderful exposition. I see this as a two-part. We can probably think about that in terms of how independent the person is when they go in, and then depending upon that, there can be categories of saying, okay, the person is self-care. If they are able to do self-care versus they're dependent on some nursing or nursing assistance or other aids. So this is a line where the family can sort of decide how much of care that the person is going, your loved one is going to need. That's one thing going in. Many times, as you said, they are they bedridden or they getting out of bed on their own. They can walk, all that stuff. So that's one area that can help if we think about that a little bit. The next couple of other points that I have seen often, having taken care of nursing home patients from a medical perspective, how is the medical coverage and how is the especially because of the chronic illnesses that they have, what kind of coverage that they carry, how what their protocol about calling the physician in, or and so on and so forth. The next area that along the lines of the medical issues is something that one can certainly have more detailed discussion with the nurses or the doctors as they go in, and so they get an idea and have a more good communication with them. The idea about having good communication and also awareness of what can go wrong from the heart standpoint, from the lung standpoint, from all the other issues that can happen. Medications, some of the medications that the person is on may have side effects, and so these awareness of the whole institution and the person we are going to, suppose we're going to put our family in, or the loved one in, family needs to be cognizant of this and have some discussion. Well, last but not the least, another point that I've often noticed is the cleanliness, neatness and cleanliness, and how the hygiene area of the nursing home is. Many a times, that may be something that needs a little bit more attention than what person likes. I think you've covered a significant amount of issues that one can look at. One more thing that you mentioned, which I really liked, and that was visiting frequently and making sure that the care is being continuity and is maintained the same quality that you're expecting. Connecting with them. There are certain individuals, particularly if they have dementia. I would like you to mention some things about dementia if there's some situation like that. But connecting with the loved ones, they can be nowadays we have cell phones and how to connect with them, how to call in to find out how they're doing. Many a times they are isolated. Not everybody, most of the time people don't like to go to nursing home anyway. and it's a psychological trauma many a times, and they're away from the home, and that can be have a lot of repercussions. So, two areas I like to mention. One is this psychological trauma of separating it and how you maintain that as a person outside, and the second point is that of somebody who is not quite let's say little early dementia or something like that. So those 2 points briefly you can mention that would really get a wonderful complete more or less good picture.
So I will sorry, I will talk about dementia. There are special units that I didn't get to mention. The memory care units they are called. That's where that they are specialized training given to the staff who take care of dementia patients, and they are usually like lockdown units, and they are significantly demented patients there who are at a very high risk of eloping. They elope the facility, so it's like a sort of imprisonment rather than being in a nursing home. So that's even harder on patients and families. But the only thing is that they are special memory care units, and if the patients have diagnosis of dementia, the family care, I mean the people who put the relatives in there have to make sure that they are certified, and the employees who are there are specially trained not just in nursing care but in dementia care, because they have extra training and they know they know they have special talents how to deal with confused, agitated and demented patients, because they are more challenging than other non-demented patients, and they have less socialization skills, and they are more dependent upon full care. So these things have to be looked at beforehand, and of course we have to make sure that the place is cleanly, and that the other thing is medications. I didn't get a chance to mention that the patients are getting medications on time, and they are not being over medicated. And that's one thing you want to make sure, that your loved one is not always in bed all the time when you go to visit them, that they are not out in the la la land, they're not always confused, and they are not physically restrained or chemically restrained, because it's against the law to be restrained clinically, I mean, chemically or physically. You don't want to see your loved ones tied down for hours and hours until the nurses get a chance to release the ties of the hands, the handcuffs, and the ankle cuffs, and that they are in one position, because they usually, well, they frequently are not rotated, and they are laying in one position because nobody listens to them, or they don't have enough staff to rotate them and change positions. And that's a big risk factor for decubitous ulcers and urine infections and pneumonias. And either the nurses would get the doctors to order heavy sedatives or keep them sedated, because they don't want to hear agitated complaints from demented patients. So these things are a big risk factors, but I don't think, on the other hand, that this can be completely preventable. And uh, I guess the best thing you can do is to, by regular communication with the doctors, what kind of medications that they are getting, how often, and you want to make sure that they are not over medicated and they are not always incontinent, laying with the soaked gowns in the urine, or they don't have decubitous ulcers, or they are not laying in their feces. But these things are very important to be checked, especially when patients are not able to complain.
Right. One of the things that I have mentioned, and I think we're going to call it, a closure at this point. But one of the things I have often seen in some of the people who visit, and I've learned from that. I had a couple of occasions. My mother-in-law was in one time for an extended facility. It was not really a full nursing home, but an extended care, which is somewhat similar, but she was not completely independent. And these are the areas where building a relationship with the staff in a nice way, not in a controversial, in a fighting way, but building a good relationship, because majority of time the people are having compassion for these folks. And most of the time, the nursing staff is not bad. It's just that they have had, long time of chronic illnesses they've seen all the time, and they also get a burnout at times. And so, supporting them, and not only that, getting in touch with them and being nice to them, and maintain such a rapport that they include your loved one as almost as a family. I've seen that happen, and I think it's a win-win situation if that happens.
Thank you for all your input.
So thank you very much, Dr. Bhatt. It was a wonderful and succinct, detailed discussion of all the points. And I think it's going to be very helpful from a number of angles, whether you're considering it, whether you're going to have somebody in there, so on and so forth. So I really appreciate your presence today, and I'm sure that it will be helpful to many. Thank you.